So welcome everyone to the webinar on the Global State of Digital Health 2020, Opportunities and Challenges of Implementation in Low and Middle Income Countries. I am Maria Al-Kousa, the GHI Academy Division Manager. The Academy is the capacity building arm of the Global Health Institute at the American University of Beirut. This is the third and last installment of the eHealth program's webinar series on the role of digital health in strengthening health systems applications in low and middle income countries. The webinar will be delivered by Dr. Patricia Michael. Dr. Michael is co-founder and policy lead of HealthEnabled, a South African-based nonprofit focused on nationally scaled integrated digital health systems. With over 20 years working in more than 40 countries in Africa, Asia, South America, and the South Pacific Islands, Dr. Michael is celebrated for her roles as thought leader, writer, researcher, professor, executive director of the mHealth Alliance, and executive vice president of the Personal Connected Health Alliance. Dr. Patricia leads HealthEnabled's work on the Global Digital Health Index and Maturity Model. She is a Rockefeller Foundation Bellagio Fellow, Johns Hopkins University Knowledge for the World Distinguished Alumnus Award recipient, British Council UK Educational Social Impact Award recipient, editorial board member of the Journal of Medical Internet Research, and co-editor of mHealth in Practice. The webinar will be followed by a 15 to 20-minute Q&A session. For those of you joining us online, please feel free to type in your questions in the Q&A box as we move along the presentation. And for those of you joining us live, just raise your hand. So please join me in welcoming Dr. Patricia Michael.
Thank you so much. It is a real honor and privilege to be here with you all, especially because coming to the American University in Beirut has been a lifelong dream of mine as I began my career in public health at the American University in Cairo, not too far from here, working on a national neonatal and perinatal health study that then led to the National Maternal and Child Health Policy and Program of Egypt, which is where I am from originally. But I don't think I could do this talk entirely in Arabic. It's a little hard for me to speak entirely in Arabic. So to get started, I just thought it would be fun to maybe share a little bit about my own journey in terms of technology and health. And so how many people here remember the first time you saw a mobile phone? Okay, this was the first time I saw a mobile phone. This is from the film. Can anybody guess which film this is? Anybody remember this film? Okay, it's the 1987 film Wall Street. So when Michael Douglas walked around with this very large device called a mobile phone. Fast forward a little bit after that, and then it started with A Girl and a Dream, and this was The Girl and the Dream. In 1999, I was working in South Sudan during the Civil War and was there to help rehabilitate the health system of South Sudan. And ended up doing a household survey on paper in 1,100 households and tallying everything up manually. And the only form of communication that we had at the time was a two-way radio. How many people here have ever used a two-way radio to communicate? So in order for two-way radio to work, not only do you have to be at the two-way radio, whoever it is that you are trying to communicate with has to be at their two-way radio, and the radio frequency has to be linked so that they can pick up your radio frequency and have a conversation. And when I was in South Sudan, we had a number of very complicated deliveries, including one that really changed my life, where we had our 2A radio, and the hospital, which was 5 hours drive away, had their 2A radio. We were able to mobilize so that the only OBGYN in all of South Sudan was there for a delivery of twins of a 16-year-old woman. And in the end, we were able to get her there safely. She had a safe delivery, but unfortunately, we learned a few days later that both the mother and the children died of complications in delivery. So, and what this sort of told me was that, yes, communication is very, very important, and technology can be very important, but it's only as good as the health system that it is there to support. So you really need to have all sort of the basic infrastructure in health to be able to really make use of technology. So this was 1999. A couple of years later, I started my PhD research at the London School of Hygiene and Tropical Medicine, looking at this new device that I saw on the AUC campus called a mobile phone, and whether or not and how we could start to use mobile phones to improve access to health services as well as health information. And this is one of my sort of favorite quotes. And what it really said to me is that, you know, and in my own PhD research, at the time, a lot of people in public health sort of looked at me like I was a little crazy because the mobile phone penetration rates in most countries was between 2 and 3%. And so not a lot of people had cell phones. And so I was the first person to start really thinking about how do we start to leverage mobile phones to improve care. And so I did my PhD research in Egypt. It was an ethnographic study looking at health-related uses of mobile phones and really looking at who the early adopters of cell phones were, how they were already starting to use their mobile phones to improve access to health services and health information. And at the time, a lot of the early adopters were medical professionals, were also people involved in transportation. A lot of the village leaders had like one mobile phone in a village that people would come to their homes and ask to use the mobile phone to be able to communicate. And even in the newspapers, as I was doing my research, you already started to see a lot of discussion of mobile phones, including, I loved this, this cartoon that was in the newspaper in 2002 of a lecturer basically giving a lecture on the harmful effects of mobile phones while using his mobile phone. So, so really quickly, I helped start an organization called HealthEnabled that's based in South Africa. It is an evolution of the mHealth Alliance and basically focuses on national integrated digital health systems. Our primary focus is low and middle income countries. And really a lot of our work focuses on national policies, sustainable programs, and user needs to really help activate the widespread and effective use of digital tools. So we play a number of strategic roles in different countries, and those strategic roles focus on everything from policy development. We do a lot of work with governments to help design and facilitate the development of national digital health policies and strategies. We also work with large health implementing organizations to think much more strategically and build their capacity in the effective use of digital health tools. We've also, and this is where the Global Digital Health Index comes in, and I'll talk a little bit more about that later. We also work on sort of raising the bar on the field of digital health and really helping countries to mature in their digital health investments. And then we work with different regions to facilitate regional networks and networking and capacity building in those areas. So now I want to talk a little bit about some of the emerging trends in digital health globally, and particularly as it pertains to low and middle income countries. So in the last few years, the World Health Organization has really stepped up in its leadership in this space. And so about 2 years ago, they launched the classification of digital health interventions. And this is a taxonomy or a standardized way of talking about the range of digital health tools and resources and approaches and ways of interacting. As many of you know, digital health can range in everything from mobile health and decision support for healthcare providers to mobile messaging for pregnant women to telemedicine consultation. So there's a very wide range of digital health activities, and this was a way to sort of bring some sort of standardization to how we talk about digital health. The next big, sort of achievement was the adoption of the Digital Health Resolution by the World Health Assembly in 2018. And if you haven't, taken a look at the resolution, I think it's a really important document that I think almost all of the member states of the WHO have signed on to. So it's likely that your own country has signed on to this as well. And it gives a very high level kind of direction for where and how member states should be operating in terms of digital health. And they just launched a new department within the WHO last year for digital health and guidelines for digital health. So, and these guidelines are, a real in-depth look at the state of the evidence in terms of digital health and provide some recommendations to member states on how they can effectively start adopting different types of digital health tools into their health systems. Alongside that, a number of efforts have been made in terms of looking at digital health for low and middle income countries, including the principles for digital development. And these are really meant more for those that are designing and implementing digital health solutions and tools. And so if you haven't seen these and you are a designer or implementer of digital health tools, I strongly encourage you to take a look at these, read up on them. They range on everything from designing with users to reusing and improving different components that already exist, designing for scale, thinking about sustainability. And then just last year, for those that are in low and middle income countries, a lot of the donor community recognized that sometimes they are not helping the situation of digital health in different country settings and actually contributing to a lot of the challenges and the fragmentation that exists within digital health. And they launched some digital investment principles. And here it's really important to note some of the acknowledgement that multiple donors need to now start to come together and support countries in maturing and in building country capacity and following the leadership roles and the national plans of countries, rather than coming in with whatever new innovation or tool they're interested in supporting. Some other tools that, that have been designed and developed, the mHealth Assessment and Planning for Scale. This is a great resource for low and middle income countries to help kind of think through the process. I often use this tool as an assessment tool to evaluate how well an implementation is doing, and then to work with partners to strengthen their digital health implementations. So one of the big areas that I've been very passionate about and concerned about has been around gender. And one of the things that we see quite frequently in digital health and in the design and implementation of digital health solutions is that oftentimes the actual software developers and the designers of the tools are often predominantly men, even though a lot of the applications that they are designing are meant to be used by and for and with women. And so there's a real important need to think about and to consider gender when looking at digital health solutions and tools. More recently, I was reading a book called Invisible Women. I don't know how many people have seen this book, Invisible Women. And I strongly, I rarely make book recommendations, but this is like one book that I would strongly encourage people to read. And the premise of the book is that a lot of the world is designed around a default male, including seat belts, including, traffic patterns and all sorts of things. And a lot of that is because there's a real lack of data and research on women, and this tendency to kind of bias things towards men. And why this becomes a little bit more dangerous now in a digital age is that we are increasingly moving towards artificial intelligence and machine learning. And if we are already experiencing bias in the availability of data that machines are meant to be reading and looking at, then we're likely to exacerbate some of the same biases and stereotypes within the use of technology. And so I think it's really important to take into consideration gender, and ensure that the tools and the systems are truly representative of the people that are meant to be using them. And one example that I love to share is from Lego. And so I think this was now probably about 10 years ago, but there were a number of studies that came out that showed that children who played with Legos were more likely to continue on into careers in the sciences, technology, engineering, and math. And that boys were much more likely to play with Legos than girls. And so Lego did a massive study on how boys play versus how girls play. So, and they didn't start from the premise of how do boys play with Legos and how do girls play with Legos. They actually just took a step back and said, like, what are girls interested in? How do they play? What do they play? And what they discovered through their research is that girls tend to like to have characters, they like to build stories, and they like to design structures from the outside in, and are very detail-oriented in their design approaches. Whereas boys were much more interested in structures and designing structures and building structures and that kind of thing. And so they designed a line of Legos, which I really enjoy myself, even though I was a Lego player as a child with like normal Legos. Lego Friends that really helps to lean into how girls play, which is very different than how boys play. And I thought it was a really good example of, what you can do or how you can approach these things if you're factoring in gender. Another major area that sort of comes with the introduction of digital tools is really around ethical considerations. And in doing a review of many different low and middle income countries, what we found is that a lot of the privacy and security policies are not necessarily keeping pace with the innovations. And so there weren't necessarily, policies around patient data ownership and how that information is meant to be stored and managed, and who can and should have access to that information. And so it's something, definitely worth thinking about. And oftentimes in a lot of low and middle income countries, this can also be very cultural. And so really thinking about what are the not just the legal ramifications of sharing of data or who has access to data and privacy and security, but really thinking about the cultural domains as well. And then finally, really thinking about the research and evidence, and I'll start to talk about some of the global trends that we've seen in the Global Digital Health Index, is really around research and evidence. So I had the privilege of being involved in the WHO guideline development for digital health. And I mean, I've been working in this space for more than 20 years now and have been doing research and have been publishing. And I thought that the evidence base was much more mature than it actually was. And what we discovered through this process is that there isn't a lot of really good, robust data on the health impacts of digital technologies and different types of tools. So there's a lot of research that has been done on usability and feasibility, user satisfaction, a lot of research in the computer science literature, but very little that is coming out of health research institutions looking at, does the effective use of certain types of digital tools in fact improve health outcomes, whether it's things like immunization coverage and or access to different types of health services. So now I'm going to turn our attention to some of the data and what we know is kind of happening in terms of digital health across a number of different settings. And this work comes through a collaboration through the Health Data Collaborative. There's a digital health and interoperability working group that's been very active in this space and has been really looking at both data use, and as we move towards more digitized data, effective use of data, but then also the tools and the technologies and the digital health that's there to sort of create this data and make this data readily available to improve access to services and information. So the Global Digital Health Index, which I've had the great privilege of working on for the last few years, is really an effort that is meant to help countries really assess where they are in terms of their digital health investments and their enabling environment, and then to track progress over time. And it's really meant to motivate countries to make the necessary investments in the enablers for digital health, alongside the investments in the actual digital health tools themselves, because we know that technology is evolving over time, that what you might be using today may look very different than what you will use in 2 years from now, 3 years from now, 5 years from now. But there are some basic things that countries can and should have in place that will contribute to greater success and greater sustainability of their digital health investments. So the general theory of change is that if countries can measure and monitor their maturity, then they can figure out where their major gaps are, make investments in those areas, and then ultimately have greater impact in terms of where and how their digital tools are contributing towards the achievement of universal health coverage and improved health outcomes. And so the index design has been done using the WHO National eHealth Strategy Toolkit, which a lot of countries use to develop their own national strategies and policies. It's a free online platform, so anybody can go into the platform and look at the data, and then countries can, opt to participate in the index, but the data has to be approved by the Ministry of Health because it's being made public. So that's like sort of the only major caveat. But once countries are in there, they can then benchmark themselves against other countries, and they can track their progress over time. So we now have, actually yesterday we got another country, so we now have 24 countries in the index. And last year we published a State of Digital Health report that includes an analysis of the data that is currently in the Global Digital Health Index. The platform also enables countries to generate a scorecard and benchmark. And so countries can see where they are in terms of the global average. So as more countries participate in the index, we get a clearer sense of where the world is, and countries can then compare themselves to where the world is and identify some of the key challenge areas where they need greater investment in order to come up to average, or areas of strength that they should be celebrating. And what we found is that in most countries, that they are quite strong in some areas and quite weak in others. There aren't many countries that are sort of strong across the board. We only have one country that scored a phase 5, and that was Malaysia, which interestingly enough, part of the reason that Malaysia scored quite high is that they've had an e-health strategy in Malaysia for over 20 years. And so they've been investing in their enabling environment for e-health for a very long time in Malaysia. And now, because of sort of non-communicable diseases, et cetera, they're also investing in a lot of the higher end technology innovations like remote patient monitoring, alongside some of the basic interventions around electronic health records, telemedicine, their national health information system. What we found in the analysis process is that, the global average is a phase 3. So, on a scale of 1 to 5, it's sort of a normal distribution in terms of countries participating, but that leadership and governance is a phase 4, that most countries have identified digital health as a priority. They've included it in their national health plans, and that they have set up some body, active, inactive, to manage and govern digital health investments. Most countries have a national digital health strategy. Some are on their 2nd or 3rd digital health strategy. But what we find is that public funding for digital health across countries is very low. It is 0 to 1% of the overall health budget. In most technology and most information intensive industries, they say that on average, you should allocate between 3 and 5% of your budget to technology. In health, we are way, way behind where investments can and should be. So if we can get countries to do 1 to 3%, that would be significantly better than where most countries are now. And oftentimes what we find in a lot of countries is that they have these huge expectations for what the miracles that they want technology to work for them, but they actually are not investing the levels of resources that would generate those miracles. So I think it's really important to like put into the right sort of context and frame of mind the financing versus what is actually happening. Most countries have sufficient policies in place for security, and a lot of this comes out of the ministries of information communication technology, and it's often in a cybersecurity policy. But a lot of times the health sector doesn't really know about it and doesn't actually take those policies and apply it to what it's doing. But where a lot of countries are weak is in privacy, as well as in really detailing data ownership. The European Union a couple of years ago ratified the GDPR, which is a general data protection regulation, which very clearly and in excruciating detail delineates who has access to what information, how that information is meant to be used, etc. And a number of countries have since adapted that for health to manage health information. So it's a good example of kind of the direction that countries need to go, but most countries have not done this and don't have sufficient privacy or data ownership policies. And most countries do not have cross-border data standards or policies, which in refugee settings is really, really important, right? So who has jurisdiction over data or over an individual's data, depending on in which country they are in. Some of the other digital health trends that we've seen through the work on the index is that workforce has low maturity. So very few countries have pre-certification, pre-service training for healthcare professionals in the use of technology. And some have sort of more in-service programs, but it's mostly in training around specific tools and not in sort of general digital literacy or general use of technology within the health system. Health information standards are often high or decent in most countries. So there are data standards. So what we're seeing is that a lot of countries have standardized their data, which is great. They have not specified how data from one system is meant to move to another system. So there's a lot of questions around architecture as well as interoperability between different types of data systems. Infrastructure is the component with the greatest variability across countries. Within countries themselves, oftentimes you'll find very high-end infrastructure in some settings and very poor connectivity and access to electricity or internet in different settings. And overall planning for digital health equipment and maintenance is about a phase 2. And then in terms of services and applications, most countries have not scaled digital health nationally. There's only like a handful of countries that have even a single system that they have managed to implement at a national level. But a lot of them are starting to put into place the building blocks to kind of get them towards that. So the registries, things like birth registries, death registries, and immunization registries, as well as health facility registries, health workforce registries, et cetera, to start to move in terms of of that direction. And so we have sort of a normal distribution for digital health globally at around a phase 3, with countries sort of equally in the phase 5, in the phase 4 and phase 2 range. When you look at the sort of where the different bands are in the major sort of subcomponent areas, what you find again is sort of this generally even distribution, except for in areas like standards and interoperability, where there's sort of just greater variability. When you look regionally at kind of where different regions are and their maturity, so one thing to note is that the index rounds up. So we did not want this to be a punitive tool. This is not about kind of punishing or embarrassing countries. It's more about giving countries visibility into where they are. And actually, each of the individual indicators is probably much more interesting and telling of where a country is than sort of the overall averages. But this gives you a little bit of a sense of who some of the leaders are in terms of regions and where some of the lagging behind is. What we find in this particular region in EMRO is that oftentimes a lot of countries have super high-end technology and they've deployed a lot of technology, but they don't necessarily have a lot of the supportive policies in place to guide sort of the longer term investments in digital health. And some of the key areas where, you know, we've seen sort of some kind of greater challenges is really around the strategy and investment area, as well as in the workforce. So some examples of country case studies in Nigeria, they used the index to measure the progress of a national digital health strategy that I had actually the privilege of helping to facilitate years ago, that got adopted by the Parliament of Nigeria. And they used the tool to sort of assess how well they were doing against their strategy as a monitoring tool. And it was very interesting because they kind of discovered some areas that they were doing quite well in, but then they had some blind spots that they had completely neglected in their implementation that they were kind of unpleasantly surprised by, but that they were able to then kind of plan for how they would move on some of those areas. Sierra Leone, which got very hit by the Ebola outbreak and had just come out of a civil war, used the tool as a baseline. So they used it as a planning resource. So they didn't have a digital health strategy, but they were planning to develop one. And so they used the index basically to really figure out where they are. And a lot of, if you look at their digital health strategy, which is really nicely done, kind of takes some of the key gaps that they identified and really designs activities against those specific gaps. And so basically to use the index, anybody can go into the index and access the data and actually export the data into Excel for further analyses. We've had some students in different academic institutions do their theses on the data from the index, which is really great. They've even sent us back some feedback on what we can do to improve the index, which we're always, you know, excited to see and to learn from. And we're trying to get as many countries to participate in the index, because as more countries participate, the greater understanding we will have of the state of digital health globally. We are now in the process of integrating the WHO Digital Health Atlas, which is an inventory tool that enables countries to map their digital health implementations with the Digital Health Index, which enables countries to get a sense of what the enabling environment looks like in those countries. But we encourage countries that want to participate to send a request to info@digitalhealthindex.org, and the system will send a unique country link. And so just as a final word, so we currently have 7.7 billion people on the planet. In 2014, we had more mobile phones than people, so we crossed the sort of threshold of people to technology. I think we have a real opportunity to improve access to health services and health information, and enable people to become much more actively engaged in their own health through the use of technology in a very sort of grounded and sensible and responsible way. So with that, I thank you, and I believe we have some time for Q&A.
Thank you so much, Dr. Michael. So we will be taking Q&A from the floor or live from the Q&A box. So I have my phone here with me. So I'll give the audience a couple of minutes. Do we have any questions from the floor? If not, oh, yes, sure.
Yeah. So her question was whether or not having a digital health strategy would require a single payer as a prerequisite. And actually most don't. So most countries don't have a single payer. What a digital health strategy does is it basically takes the current situation in a country in terms of where digital health tools are being used and what the health priorities of the country are, irrespective of who pays. So it factors in the private sector, it factors in the role of the public sector, it factors in the financing, et cetera, and it creates a framework that countries can use to help guide the investments within the country towards kind of a single vision and mission for how they want to use technology to improve health within the country. Yeah, most countries don't have, they have digital health strategies, but they don't have a single payer situation. And it actually makes a lot more sense in countries where you don't have a single payer, because what it does is it enables all of the different players to contribute to the same set of targets and the same set of goals. It's a lot easier to do digital health in a setting where there's a lot more public control and public engagement.
I have a question. So you mentioned the report on the state of digital health in 2019. Mm-hmm. Were there any emerging trends in terms of low and middle income countries or fragile settings in general, in terms of the state of digital health?
Sure. So most of the trends that I reported on today, most of the countries participating in the index are actually low and middle income countries, and so a lot of them pertain to those countries. And I would say what's interesting, if you look at some of the fragile states, so Afghanistan, Pakistan, a few others, Sierra Leone participated in the index. What we found is that for them, originally we thought that countries with higher maturity would be more excited to participate in the index because they could show off kind of where they were in terms of their digital health maturity. But what we found is that it's actually the countries that are struggling the most that were more excited to participate, because they wanted to at least like document where they are in terms of digital health, and then start to encourage investments in key areas so that they could actually start to move forward in terms of digital health. And we saw that with some of the fragile countries that participated in the index.
And on that note, in terms of the countries that you've mentioned, were there any cases, like successful cases of like either moving from paper-based to digital, or any other successful cases of change?
Sure. So far we only have one year of data in the index. And so the idea is that we would do this at least once a year, and it would be an opportunity for countries to kind of report back how they were doing in subsequent years. And so we could measure maturity and start to document some of those success stories. What we did find were that a lot of interesting anecdotes from some countries where they, the bodies that were participating in the index, like, didn't really know what the state of, say, the workforce was in terms of digital health and professionalization of the use of technology in the health system. And so they ended up, scoring themselves quite low, and came back to us and said, okay, next time, like, we're gonna go find this out, or we're gonna put in systems so that we can actually better track some of these areas.
Perfect, thank you. So I'm just gonna, there's a question from the audience. So when you use digital health to provide awareness raising messages for pregnant women, how were you able to evaluate effectiveness? In terms of data collection using digital health and mobile applications, how are you able to do so in respect to privacy, especially in data relevant to sexual and reproductive health?
Sure. So I've been working on a study that we've implemented in 3 countries on age and stage-based mobile messaging for pregnant women and newborns. And we looked at SMS messaging, we looked at voice messaging, and a lot of the ways that we measure effectiveness are the same ways that we would measure effectiveness of any, like, general health intervention. And so I think in the early days of digital health, we thought we needed some, like, magic way of studying, whether or not digital health was effective. And in the end, we kind of went back to the roots of public health and said, no, like, the same mechanisms through which you would, evaluate how one tool versus doing nothing or another tool might work. And so I always favor, like, randomized control trials if and when you can do a randomized control trial to measure effectiveness of technology interventions on health outcomes. So if your goal is to really get to the health outcomes, that's sort of where we need to start. Sometimes we're not in a situation where we can do that. Like, I was recently working on an immunization project in Indonesia, and there we were doing a nationally scaled program. And so we did a natural experiment, and we sort of created a natural experiment within the program to try and measure effectiveness of that. And so with that, on the privacy and security, like, aspect, you would apply the same ethical considerations that an IRB would, make sure that you are engaged in. And so now, oftentimes when digital health implementations are being implemented, particularly those that are planned for national scale, especially if we think that at some later stage, some researcher is going to want to do research on that data, I think it's really important to apply the same ethical considerations and put the implementation of the tool and any potential research of that tool through an IRB mechanism to assess those ethical considerations and consent when you are consenting people into the use of the tool, like, really letting them know that their data could potentially be used for research purposes. And I think that that is the responsible, I think we have a responsibility both from being responsive to health needs of people, but then also respecting their right to privacy and security, and to treating that data the way that we would if we were, subject to research level IRBs.
Two more questions. So the first one is the index applicable for interventions related to telemedicine or interventions related to treat patients with chronic diseases, and are there any available data? The second question, can you comment on the importance of aligning mHealth work with the ministries of health, ICT, etc. from the start versus bringing an already piloted tool to the ministries at a later stage?
Sure. So I think in terms of telemedicine and non-communicable diseases, all of the indicators in the index would apply to those types of systems. There are one in particular that really applies is the one on device regulation, particularly as countries in a lot of mobile telemedicine programs are also starting to introduce remote patient monitoring. So making sure that safety considerations are taken into effect and that the maturity of the systems are there to keep pace with the technology. So I think that's one. If it's a specific implementation, then I would encourage you to take a look at the MAPS toolkit as an assessment resource, as well as the Digital Health Atlas, which is a digitized version of the MAPS toolkit. And I often use that to evaluate implementations of digital health tools. And then your second question was, pilots.
Yes.
Pilots versus.
At a later stage.
Okay. So I think we need to stop doing pilots. So I don't know how many people, I've stopped showing my slide of Uganda where there were like 50 pilots 5 years ago, and a lot of them doing a lot of the same thing and the same activity. I think the poor ministries of health and ICT have enough going on that they do not need to see 1,000 small projects coming in. I think what you need to do is think about the use of technology and design for scale, design for long-term sustainability and impact. Look at the principles for digital development, look at existing systems and tools. It's very rare that there's a new area for which there isn't already some existing tool that does the thing that you think needs to happen that could be adopted rather than reinventing the wheel. So there's a whole movement around global goods and global software goods that is out there for open source electronic health records, for logistics management systems, decision support systems, and all of that. If you are interested in implementing something at scale and your intention is that at some point you want it to be taken up by the public sector, then yes, by all means, engage the public sector as early on as you possibly can in that process. They don't like to be brought in at the very end of anything. They also like to make sure that what it is that you are proposing fits in with their national priorities and policies, etc. So I would do that. I would first, look, see if there's other stuff out there. Look, see what has actually been implemented in the country itself. You'd be amazed at how much stuff is already being done, and then figure out like if there is still a niche that you can contribute to or do something around, then it should be something that is really going to be well positioned for scale and impact and sustainability.
Perfect. So the last question is on Malaysia. So you mentioned that Malaysia is at stage 5 of the index. What lessons can we learn from the Malaysian experience?
I think, what I appreciate about Malaysia is that they will both invest in innovation and new technologies, but they don't forget the basics and the building blocks, right? So they keep pace, their policies and their strategies keep pace with what is going on. And I think that is sort of why they've been very, very successful at both having the sort of roots and guiding documents on the one hand, the workforce, as well as being able to take on new technologies quite quickly and scale them quickly.
Perfect. Thank you so much, Dr. Michael. Please join me in thanking Dr. Michael for this very insightful and interesting webinar. And hope we'll be able to have more webinars in the near future. Thank you so
Sounds
much.
good. Thank you.